instruments and a few things that we use in the dental profession. All right? And then if you guys have any questions, feel free to ask. But a lot of this stuff, I'll have gloves on when I use it, but it's not sterile, and so don't pick anything up. Okay? So come on back and we'll take that.
Smile, you're on camera. And then Pego will be here shortly.
Oh, he will be there?
Yeah.
I'll wait till he's
Yeah. Wow, these are cool offices, huh?
Yeah.
Yeah, so people can actually see a picture when they have their teeth drilled.
Yeah, so a lot has changed in dentistry. We have digital radiography now, so like when we go through and take radiographs, exactly. Yeah, the assistants can pull it up there and we can show the patient this is exactly what you have. We can take intraoral photos and say, okay, this is why you need what you need, basically. So it helps us out a lot as far as patient education, showing the patients why they have different dental needs. Okay? So, okay, and so a lot of things are digital. Kathy will pull this stuff up. I know how to do the dentistry, but the assistants help us with doing all this other work. Okay, first thing I'm going to show you while she's pulling that up. Okay.
Is that a camera? No.
What I have here, these are what we actually put in your mouth. These are the business end of what we do when we're fixing cavities or doing crown preparations or any number of those things. Okay. Anything restorative wise, we're going to use these drills. Okay. These drills, okay, and I'll show them to you. Don't grab them just because I don't know that they're clean. You see how they're a little bit sparkly? What do you guys think that might be?
Diamond chip?
That's exactly what it is. These are all impregnated with tiny little diamonds, okay, because diamond's very hard.
Yeah.
Your tooth structure is hard. And so these diamonds, this rotates at an extremely rapid rate, around 100,000 revolutions in a minute. Okay, it rotates very rapidly.
So do you guys remember what the hardest part of your body was? We talked about it in our last...
Teeth.
It's your teeth. The hardest substance in your mouth is enamel, the part of your teeth that you can see when you smile. Okay, so one of the drill bits that we use, or burrs is what we call them. Some are impregnated with diamonds, and then we also have some that are carbide. Okay, and they're basically, here's an example of a carbide burr. Okay, and it's just a highly polished piece of metal. Okay, it's not diamond impregnated. Okay. They're actually not that expensive. Tiny little diamonds aren't that expensive. Around one of these burrs, you'd expect to spend anywhere between $4 to $8.
Okay. But still expensive for such a small thing.
Yeah, yeah, it's not totally cheap, but it's not going to break the bank either. Okay, and then there's some that are more coarse. Okay, that we're going to use for gross removal, and then they start to get finer and finer. Okay, so that we can polish the surface so that it feels smooth in your mouth. Okay, and then after we do that, then we can even go to something that's even finer when we're polishing a restoration or polishing a crown if it needed to be adjusted before we put it in your mouth. Okay? Kathy, did you pull that up so it's up there? No. Okay. Right here, Sister Anderson was kind enough to pull up her personal radiographs. Okay, so right here is a digital representation of her radiographs.
Okay, I'm going to sneak past you guys so I can film this here, okay?
Okay, and I can make this as a full screen picture, and this is a picture of her upper right hand side, okay? And on this you can see a lot of different things. Okay, remember how we talked about the anatomy of a tooth and a tooth that needs a root canal? Do you guys see this dark line right there? See as I trace that? What was in that part when we depicted that in our drawing? What was that?
Tooth.
Okay, this is a tooth, but what's in the center of the tooth there?
The Nerves.
The nerve. All right, that's the nerve in the blood vessel of a tooth, right there. Okay, so where it enters in, okay, it comes, that nerve and blood vessel, they come and they enter in here, and it supplies sensation, how you can feel with the tooth, and it also provides the vitality. Okay. So when you drill into this, right here, when we go all the way into that, then it'll start to bleed usually. Okay. Here, this is a molar. The anatomy is slightly more complex. Right here is the main chamber of the tooth, and then you can see the canal come and trace all along there. Okay. Okay, so there's 3 roots. Okay. This right up here, okay, sometimes if you get a sinus infection, it can actually make it feel like you've got a toothache. Now, why do you guys think that might be?
Because the nerve
Because your
close.
sinus cavity is close to your
Nerves?
mouth.
That's exactly right. The sinus cavity is close to, okay, so this right here is the floor of the maxillary sinus. Okay, so your sinus there, if you had a really bad sinus infection, it can actually make it sometimes feel like you've got a toothache. Okay, and that's why sometimes that can happen. Okay, so we'll go back over here and we'll look at some other different pictures. Okay, Kathy, let's see, I think it's this tooth here that Kathy, all right. So, Sister Anderson takes very good care of her teeth. In her whole mouth, she only has 1 cavity, okay, and it only had 1 filling. And that's
Her whole life.
Yeah, that's it.
Wow.
Okay, so she takes good care, and that's what that looks like there. Okay, so when I look at a radiograph, if I see something that looks a little different, that's what that is. That's a filling. Okay? And she's actually lucky because we can tell that it's fairly close into the nerve. If it had only went just a tiny bit further,
Root canal.
she probably would have needed a root canal and a crown instead of just a filling. So that's why it's important to visit your dentist every 6 months to a year, so that if you have a cavity, it doesn't get big and end up causing you big problems. Okay? When we catch them when they're smaller, we can more often than not take care of them as opposed to getting into bigger issues. All right? Any questions about anything we've talked about, guys? No? All pretty self-explanatory?
Yep.
Okay, good. All right.
One question.
Go ahead.
So what would happen if you haven't been to the dentist in 2 years?
Maybe nothing. Okay. Maybe you got a mouthful of cavities, or maybe you have none. Okay. Just because you go to a dentist, it doesn't preclude you from having decay. It also doesn't cause decay. Okay. It just when you go regularly, then we can catch problems when they're smaller. Okay. All right. So now what we're going to do is we're going to go through and I'm going to show you. I've showed you some burrs and things that we do to clean cavities out. Now I'm going to show you some instruments that we use to restore them. We're going to talk about the different names of them. And that's part of you guys' merit badge requirement, is to be able to name different instruments that we use. Okay.
So,
Is there a question?
Ben
Go
has a
ahead,
question.
Ben.
So do you guys like make molds of teeth? And
Uh-huh.
stuff?
Yeah, we do. And there's different reasons why we might do that. Okay. Hypothetically speaking, let's say Sister Anderson said that this would have went into the nerve. She would have needed a root canal. After that, then she needs a crown. Okay, because once we take and remove that, we need to give something to give it structural strength and support. Okay, so what I do as a dentist is I then take and reduce this tooth structure in all dimensions. I shrink it by about 1.5 millimeters to 2 millimeters. Okay, and then we take an impression of that, take a mold, send it to a lab, and a lab technician fabricates a crown that we can then take and cement onto her tooth, and it can function just like her own natural tooth. Okay? All right, so what we have here, when you guys go into the dentist, do you ever feel him kind of poking at you and feel like he's, you feel that metal thing running across your teeth? Okay? That's what this is, and this is, we call this an explorer. Okay, everybody
Because
see
it
that?
explores the mouth.
Okay. Real sharp ended. Okay. The reason that it's sharp is because when I am going over your teeth, remember that your enamel's very hard. Okay. And so most of the time it's going to just slide across it just like glass. Okay. But when you've got a cavity, it's going to stick. Okay. So it's going to stick down in there, and because that tooth structure has been demineralized and it's now cavitated. So if you ever get something that sticks in there, you've got a cavity. Okay, so that's what we use that for. So what was
And
this
that's-
called?
And it's pretty evident when you're doing that. Can you normally see it from off the X-ray though?
It
huh?
depends.
Uh-huh.
Okay, decay, which is in between teeth,
Right.
shows up very clearly on a radiograph.
Mhm.
Decay on an occlusal surface has
Doesn't.
to be large
Ah.
before you can see it on a radiograph.
Gotcha.
That's why we depend on this large size. Okay. All right. This instrument here, okay, it's called a ball burnisher. Okay, and what we use this for, okay, we can see it's got one end down here that's kind of big and round, and then another end that's pointy. Okay, and then this end right here is kind of round. Okay, so basically what we do with this, most of the restorative material that we use now, it's white instead of silver. When I was your guys' age, everything that most dentists put in your mouth, it was silver. It's called
My mom
amalgam.
has silver fillings.
What's that?
My mom has silver
Yeah.
fillings.
I got silver fillings.
Yeah, I still have a few of them in my mouth. Okay, and basically it was a mixture of metals. Okay, silver, tin, mercury, copper, and
Mercury?
yeah, it has mercury in
be
it.
bad for you?
Well, in theory, if it was just mercury, but it's a mixture of metals. Okay, and so the mercury in it allowed us to basically condense it into the cavities, and it's still something that it's used today, but not as common. This instrument is very handy when restoring a composite because it's a composite resin, and we can basically take and gently push that down into the cavity. Okay, when we did the silver restorations, we had to pack them very firmly. Okay, and place a lot of pressure in somebody's mouth in order to make it dense. Okay?
Yeah, we have a question.
Oh, okay.
How come they don't use silver fillings anymore?
Well, because silver restorations, they are still used, okay, but not as frequently, and different dentists don't use them for different reasons. Personally, I like the white ones, okay, and the reason is because when I take and I remove all the cavity out of somebody's mouth, that's all I have to do with a white restoration. With a silver restoration, it does not bond to the tooth, and so I have to undercut it, which I'm removing more healthy tooth structure that way, and I'm also weakening the tooth. Okay, so with a white restoration, I don't have to do that. I
Why
can
would you
remove
Because it bonds better to the tooth then, or?
the white restoration. It's a resin composite
Okay.
which bonds.
Okay,
Okay.
right.
And it's
As-
also aesthetically better.
Oh yeah, yeah,
Looks
yeah,
nicer.
right,
So what's
exactly.
the, why was
But the silver restorations do not bond at all. It's a
Mm.
lock and key.
Gotcha.
Okay? I have
Gotcha.
to undercut it, therefore removing healthy tooth structure which otherwise did not need to be removed.
Yep.
Okay?
So, why would you choose silver over white?
Well, in most instances you wouldn't. Okay? A silver restoration is less expensive. Okay? A silver restoration is also more forgiving. Let's say a person, you just couldn't, with a white restoration you have to keep it dry in order to place it. If you have saliva on it, it's not going to work. Okay, so let's say you had a cavity way down deep below your gum line and it was bleeding. Okay, a silver restoration you could place and it would forgive basically. You could pack it down in there and make it dense and it would seal. With a white restoration you can't do that. If you can't get it dry, it's not going to work. Period. Okay.
That's why.
Yeah. So that's any number of reasons. Okay. This instrument here is a cord packer. Okay. This, do you guys see the kind of shovel-end shape on the end of that? Okay. All right. So, how many of you guys in here have ever got something stuck in your teeth after eating popcorn?
Oh,
Yeah?
I was
Okay.
choking
And it feels like you can't get it out, and it's just like, where is that? I can't get it out of there. Okay, remember there's that little space in your gum tissues that's in between the tooth and the gum. Okay, when I take and I do a crown preparation, okay, usually I'm going to prepare that somewhere around right there. Okay, I'm going to prepare it a couple millimeters above the height of the bone. Okay, And in order to record accurately right to where I have prepared that, I take a little thin piece of string that's knitted, okay, so that I can compress it, and I place it all around the tooth. And this is what packs it down in and around there so that it expands the tissues, and then I pull it out, take an impression, okay? And so that's what that instrument's used for, okay? Okay. This instrument looks very similar to the last one that I showed you. Okay, but this is it's basically simply called a spoon. Okay, so let's say I'm doing a filling, I'm doing a cavity. Okay, and I'm removing that. Usually, when I'm going to remove that, after I've drilled through the initial portion of the tooth, I'm going to use an instrument similar to this. Okay, and I'm going to use a slow speed drill. Exactly. How many in here have had a cavity? Okay. Did you feel something in your mouth that vibrated a lot when they were drilling it out?
Yeah.
Okay. That's what this does. Okay. Let's say I'm getting in close to the nerve. I'm going to want to slow down even more. Okay. This goes slower than our high speed. It spins very, very slowly. But then as I'm getting in close to the nerve and I know that there's still cavity, I want to be really careful that if I don't have to expose the nerve, that I don't. Okay, so I use an instrument like this, and the cavity is soft, so I can take and I can scoop it out. When I've got all the cavity removed, it's hard, okay, and it becomes very hard for me to take and do this. So if you feel the dentist in there scooping with something, that's what he's doing. He's in close and he wants to get all the cavity out prior to placing the restoration. Okay, so that's what that is. Okay. Yeah.
Should we hand these out so that they can take notes? Because there is a few slides.
Basically, yeah, I'm just going over instruments right now.
I would say that since they're here, you know, that it should be fine. You know, unless they can do that later on for their own benefit, for if they want to take that home with them. But in terms of the requirement, it's okay.
Okay. And then this is a very handy piece of instrument. What do you think it is? It's a mirror. Okay. So that I don't have to sit there and break my neck when I'm all the way hunched over trying to look at the different parts of your mouth.
Or sit on your head, huh?
Yeah, exactly. Okay. So everything I do in dentistry, I almost always have a mirror in my left hand. Okay. If I was left-handed, I'd probably use the other way. Okay. All right. So, what do you guys think this is?
Clamps.
Ooh.
What do you think I use that for? Yeah.
To hurt
Yeah.
kids.
To hurt kids.
This is a oh. This is a syringe. Okay. So what I do with that?
Yeah.
Okay, I take and I load a needle onto this end. Okay. And then I take and I can load a carpule of anesthetic into there.
Is it nummy? The numb?
Yep. And then do you see the end of it here? Do you see that harpoon there?
I never knew that it was a needle. And then
Okay.
I found out. And then I went to the dentist and I didn't want to get a shot.
Yeah. Okay, so that harpoon, there's a plug on the end of a carpule of anesthetic. Okay, and so there's blood vessels all over in your mouth. So when I go to give somebody a shot, I don't want to be injecting it into a blood vessel that'll make your heart rate race. Okay, so what I do to check to make sure I'm not in a blood vessel when I give an injection is I pull that back. Okay, if I'm in a blood vessel, this will fill with blood. Okay, and so what I do is then I just change location of my needle and then deposit my anesthetic. Okay, so that's the benefit of having that little harpoon is I can then, it's called aspiration. I can then just take and pull it back a little just to make sure I'm not in a blood vessel. Wouldn't really hurt you. It'd just make your heart race, make you feel like you drank a pot of coffee. Not that anybody in here has done that. Make you feel like you drank a whole bunch of Mountain Dew or Red Bull, something like that.
Yummy.
Do they use that shot for like to numb us?
That's exactly what we do. We use it. We use it to numb.
And also for pulling teeth as well, because they gave me a shot when I had to get a tooth pulled.
Yeah.
Then they have like this orange stuff or whatever, and they put it in the top of my mouth or something.
Yeah. Usually, prior to doing any dental procedure, you'll receive an injection. other than a clean, you'll receive an injection to numb the tooth. Okay? So whether it's to pull the tooth, to do a filling, to do a root canal, to do a crown, any restorative procedure. Okay? Are there any other questions? Go ahead.
How come dentists always talk to you when they've got their
When
hands in
they-
your mouth?
Yeah, to distract you.
So they don't hurt you too
Yeah, it's kind of hard to answer when you're.
So they don't hurt your
Since
heart
I can talk
and
sort
your
of well.
teeth.
But we can usually understand most of your responses. You know, we hear people talk like that every day.
Except for when you're
Oh, I have a
screaming.
question.
Okay, go ahead.
Can we do a demonstration?
A demonstration? Sure, you want me to give you an injection and numb your jaw?
Have a
Yeah.
root canal.
No.
Yeah, Brandon wants
That's
to
not
know.
here.
Up for it.
Okay, Sister Anderson has brought us some other models. Okay, let's say that you didn't take good care of your teeth. Okay, what's going to happen?
Cavities.
You're going to have cavities. Let's say your cavities get so bad that I can't restore your teeth. Okay, people who get into drug use, it can rot their teeth. Methamphetamines. Okay, people who use different types of drugs. That is another good reason to stay away from drug use. Okay.
And the machine.
Is it'll rot your teeth. So people, in those instances, we have to do dentures for them. That's what these are, examples of a denture. This is a lower denture, this is an upper denture. Okay? So if you see somebody whose teeth looks just a little too perfect, they might be dentures.
Yeah.
Okay.
I heard some dentists make slightly offset dentures so they look realistic.
You know what? You can do things like that. Sometimes patients have those type of requests. Yep. Go ahead. Go ahead. All right.
Just don't drop them.
Yeah.
Okay, great.
All right, so go ahead and pass those around. Okay, with an upper denture, don't try and...
Yeah, I wouldn't put them out.
With an upper denture, okay, believe it or not, with an upper denture, you can create a lot of suction up against the roof of your mouth, and they'll stay put fairly well. With a lower denture,
What if you
have
lose these
no
teeth?
suction.
You
okay?
can.
And basically, it'll float around in your mouth, okay?
You got gravity, so.
You
So
got
do-
gravity,
do-
but the lower denture is going to give you a lot more problems than the upper dentures will. The upper denture, you can create a seal with suction that'll hold the denture
Just be careful, okay?
hold it in place, and they can use it. Okay? All right, so that's what dentures are. Any questions about them? No questions about dentures?
Can you get a second pair if they break?
Yeah, of course you can, but you got to pay for them.
It's
Okay?
expensive.
They are.
What was the question? I didn't hear it.
Can you get a second pair of dentures if you break?
Oh, okay.
She
Right.
asked if they're expensive.
Yeah.
Okay. All right, so that's what dentures look like, okay? Another thing, there was another model right back there, Kathy. Yeah, okay. Let's say, does anybody here grind their teeth at night? You do?
Mine take a lot.
I have a night guard.
Yeah, that's basically what we do is we want to put a night guard on a person like that so that they wear against the night guard as opposed to their teeth. Okay, because what happens is over time, you'll wear the tooth structure away. And so you want to have a night guard if you grind your teeth. That's what that is. Okay?
What if you wear it during the day too?
Probably not necessary. Why would you be grinding your teeth during the day?
When you're cold.
I don't know.
Yeah.
All right, if you spend a lot of time, I mean, certainly you could come up with a reason for it.
Can I hold the big one?
We'll get to
Yep,
those in just
yep.
a minute, okay? All right, so here's a model
Yeah, I don't know.
which is depicting an implant. It's called, remember, oh, did you not get it? Sorry, okay. All right, remember we were talking about implants and implant overdentures? That's what this is, okay? This is depicting 2 implants into the lower jaw, okay? You guys see that? Looks like 2 little screws threaded down into the bone. That's what it is, okay? It's not a whole lot different than the screws that you'd place in a wall.
Probably hurts
Okay? Well, it's not bad. Okay?
Have you had
The denture has housings in it, which then it takes and helps to retain and keep that lower denture down. Okay? Kind of snaps down in. Okay? I'll go ahead and pass that around. You guys can have a look at that. All right, go ahead. Sorry.
Could you like pull it off?
You can pull the denture off, but the implants are embedded in the bone. Okay? It's going to heal. It's not. They're not coming out. Okay?
Broke it.
Took it apart.
Okay. All right, so remember we were talking about crowns and bridges, okay? This is an example of a bridge. This is a high-end bridge, okay? One like this would be very expensive, okay? Because as you guys can see, there's no metal in it, okay? So nowadays in dentistry we have more advanced materials, okay? And they can manufacture or mill this out of zirconia, okay, as the backing instead of metal. Have you guys ever seen somebody smile? It looks like they got gray lines up and around their gum tissues. Okay, that's because they have a crown that contains metal as its backing. But now in dentistry we have different materials which are all white, and then we can place ceramics on there and achieve a better looking result. The other thing for you guys to look at on here, if I don't drop this, is, remember how I said when I prepare a tooth for a crown? Okay, I reduce the tooth structure in all dimensions. Okay, top all the way around. Yep, that's what crown preparations look like when I'm done with them. Okay.
Took out the front teeth.
Well, the front teeth are in this case are missing, so we do a bridge to replace those missing teeth. We've got the option of a bridge, or implants, or a removable partial denture. Prior to the implants becoming available to us in dentistry, all that would have really been available would have been a bridge. Okay, so you guys can take this off and have a look at that and pass
just
it around.
be careful with that one though.
Okay. All right. Well, that's pretty much all I've got for you guys. Do you have any other questions? We'll go down and talk more paperwork, but that's pretty much it.
How useful would what's it, a denture, right? Be when you're chewing up a steak?
That's a good question. Okay, let's assume with your own natural teeth that you have 100% of function. Okay, with a denture, you have about 10% of the function that you have with your own natural dentition. Okay, so only about 10% is useful. Okay. When I do dentures for somebody, I tell them it's similar to me cutting your leg off below your knee. You're never going to be able to run, again, like you did with your own natural leg or walk. You've got to learn to talk and eat with a denture. It's a prosthetic. Okay? With an implant over denture, you can achieve maybe around 50% of the chewing function that you have with your own natural dentition. So implants really give us a lot of good benefit. Okay? So they're
What a bridge.
What's that?
What a bridge.
Well, at the bridge, you're pretty much not even going to notice that it's there. Okay? Yeah, so a bridge is a good thing. Okay. All right. Any other questions?
I think it'd be interesting for you to tell them about how you do oral cancer screenings and how you feel around the glands and how you, a lot of times dentists are the first ones
To notice, yeah, okay. All right. So when you go into a dentist and he feels down underneath your chin, or he takes and runs his fingers along here or up along your clavicle, okay, or in behind your ears, and he asks you to open and close, what he's looking for is he's palpating your lymph nodes, okay? He's looking for different things as far as checking for oral cancer. And then he asks you to open your mouth and stick your tongue way out, and he checks all your soft tissues to make sure that they look the way that they're supposed to. If you see areas of white, that's not normal. Okay, could be caused from different things. It could just be a thickening of the tissue or a keratinization. Okay, or if you have red spot lesions, that's a concern. Okay, all those are indications of oral cancer, which sometimes have to be removed and biopsied. Another question? Go ahead.
Brandon.
Have you ever had a patient with oral cancer?
I have.
How many?
I don't remember off the top of my head, but I've seen patients where they've come in and whole sections of their jaw have had to have been removed, okay, because they had cancer, which if it had not been spotted and detected by the dentist, it would have killed them. Okay? So, any other questions? No? Okay, well why don't we go ahead and go back down into the waiting area, and then I'll go through a few more things with you guys. Okay?
So is that the TV, or is that where you actually see
Well,
the?
you can use it for two functions. You can like put a movie on
Okay.
and watch a movie during a procedure, or we can pull like
And
this
show-
up and say,
right.
this is what you have going on.
Gotcha.
Okay, and so you see this big area of decay.
Uh huh.
You see this big fracture on your tooth. This is why you need a crown, even though it doesn't hurt.
Right.
And so forth. So, instruments that I showed you guys. Let's hear 5 different ones. Go ahead.
The Explorer.
There was an Explorer was one.
It was like a burnisher.
Yep, there was a ball burnisher.
Spoon.
Yep, there was a spoon.
The shovel.
Yep, there was the cord packer.
Yeah.
How did it kind of show?
The mirror.
Mirror, there you go. Okay, so there was 5. Okay. All right. What I want you guys to do, all right? You got a homework assignment. Okay, this is be the last part of completing your dental merit badge. We'll wrap everything else up next week. I do need just a couple minutes, like on a chalkboard, and
Sure,
then we'll just do
that
an
works.
overall review.
Okay.
But what I want you guys to do as an assignment is I want you to keep track of everything you eat for the next 3 days. Everything, the whole 9 yards. If you have a piece of candy, you need to write it down. The only thing you don't need to write down is water. Okay, if you have soda, fruit juice, anything like that, write it down. So for 3 days, 3 24-hour periods, write down everything that you eat. Okay? And then what we're going to do is we're going to talk about those food choices and how basically their reaction with bacterial plaque, which can then cause dental decay, and we'll talk about the process of decay. Go ahead.
Would juice count?
Juice definitely counts as something that caused cavities,
Okay.
believe it or not. If you're going to have juice, you should have juice with meals. Okay? Sister Anderson's going to pass around one last thing. Let's say, for example, you were missing, let's say, half your teeth. We could do something that's called a removable partial denture. In some instances, you're missing too many teeth, or the teeth that are missing are in areas that we can't put a bridge or an implant. We can then take and put something in that's called a removable partial denture, and that's what she's passing on. Okay? Do what? Do what? To ask her if she wants it to. Okay? All right, and then also, as you guys are doing that, snacks, everything, okay? Everything that you eat for the next 2 days. Go ahead and ask her if she wants it. Piece of gum, yep, write it down. And whether it was sugar-free or not sugar-free. Okay? So that's got clasps and things that basically will wrap around your other teeth in order to give it some retention to hold it up in there. Hey guys, everybody in the individual chair, please. Okay. All right, so that's everything that we have for today. This is Dr. Songer, who's been kind enough to let us come over here to her practice.
Yeah. Thank you so much.
Oh, you're welcome. So I think you guys should stand up and show her what good Boy Scouts you are, and who wants to lead us in the oath.
Ben knows how. I know Ben knows
All
how
right, Ben.
because we've had Ben in our.
That's
troop
right.
For long
That's
enough.
right.
But
Okay,
I
you
know
guys.
that he knows it. All right, come on, guys.
On my honor, I will do my best to do my duty to God and my country, and to obey the Scout laws, to help other people at all times, to keep myself physically strong, mentally awake, and morally straight.
Let's do the Scout laws, okay?
A Scout is trustworthy, loyal, helpful, friendly, courteous, kind, obedient, cheerful, thrifty, brave, clean, and reverent.
Okay. Very good, you guys.
Thanks, Dr. Saunders.
Yeah. Thank you very much.
All right. Are there any other questions? What do I want you guys to do for 3 days?
Write down
So-
everything you eat.
Everything.
But I eat so much stuff every day.
Well, write it down. Do you eat more? Do you eat more things than your hand can write down? No, you don't. You're too skinny. All right. Everything you eat and drink, anything you put in your mouth with the exception of water for the next 3 days. Okay?
Okay.
All right, that's everything. Next week we'll go ahead. Even mints, even at school, write it down. You can keep a notepad with you.
Oh yeah.
Doesn't matter.
What if you put a
Write it
pencil in your
down.
mouth?
Okay, and then Sister Anderson has an announcement.